Hi everyone, this is my video to go along with my thesis. My thesis was based upon the mental health treatments for PTSD in veterans in their local VA medical centers. I came about this topic because of my own experience, my family members' experience, my friends, just very poor experiences in their treatment of PTSD in their local VA medical centers. I know my experience was very sad and not helpful for me at all. I came home, I was struggling with depression and anxiety, nightmares. I was having suicidal ideations. I was really struggling, and so I went to the mental health provider at my VA medical center, and I was only offered medication. I was on medications for depression. I was on a different medication for anxiety, a different medication for nightmares, a different medication to help me sleep. And all of these things helped for a little while, but at the end of the day, I didn't want to be on medication for the rest of my life. When I asked my provider if there was something else that we could do, I was told that they didn't have time for that. They were busy and overwhelmed. So I consequently started seeing an outside provider that I do pay for myself. Unfortunately, and it becomes expensive. It's an additional cost, but I have not been on medication for the last 5 years, and I'm learning the life skills that I need to manage my everyday PTSD and depression, anxiety. My brother is not as fortunate. He goes to his VA medical center for a traumatic brain injury and PTSD. He gets on different medications every time his body adjusts to them. So unfortunately, he goes to his local VA about every 6 months after his body adjusts to the medications he's on, and he's placed in the inpatient psychiatric ward so that he can be weaned off of his current medications in a safe manner and placed on different medications. And I just feel like that's a sad way to live life, because there are so many other different treatments that are available and that are out there. So this got me thinking, what are the guidelines for treating PTSD? Does the VA have guidelines? Do they follow them? What's going on as far as leadership in the treatment of PTSD, because something is off here. So in regards to the leadership, the VA core values include integrity, commitment, advocacy, respect, and excellence, and I just find those things are not being adhered to. The goal for the VA should be to meet those core values, and I don't feel that in their treatment of PTSD they're meeting those values, especially the advocacy, because if you see a veteran who's continually on medication, who is struggling with everyday life, and they're on different medications every 6 months, where's your advocacy to get them the treatment where they can lead a productive life in society and with their families? And I just feel like they're missing the mark when it comes to their core values. We know that the culture in the VA is a toxic culture. We know this from previous VA scandals, as recent as the waitlist scandal. And we know that the culture is that if you go to leadership with information and they don't want you to undig the dirt that is going on, you will be fired. And whistleblowers get fired. They're not appreciated. It's not a safe culture to bring up issues. And that's a big issue in leadership. You need to foster an environment where people have a safe place to share their ideas or share concerns or come to leadership with ideas. They need that. They need to feel that, and that begins with leadership. Getting the entire system in a room and on the same page, saying these are the VA core values. What do we need to do in our single department to make sure that we are meeting those core values? And then what is each individual VA doing to meet those core values as a whole? Executive leaders affect culture in both formal and informal ways. Senior leaders have the ability to create, maintain, or change formal and informal culture systems by what they say, do, or support. I don't think that the top leadership understands the effect that they have in setting the tone for the culture of the entire VA, and so that needs to be looked at. In regards to the treatment of PTSD, committees have been brought in to study the treatment system of PTSD, and those committees reviewing the VA Medical Center and their treatment could not determine if the VA leaders adhere to policies, encourage staff to follow guidance, or use the data from their specific specialty PTSD programs to improve the way they manage the disorder. So if the committees cannot determine that the VA is following these guidelines and leadership is not encouraging staff, how can veterans feel secure in their treatment or know that they are getting the best treatment that they should be getting? I don't feel that they can know that if outside committees can't show that leadership is doing their job. Going into some of my research, it is proven that veterans who screened positive for PTSD are 4 times as likely to commit suicide or have suicidal ideation compared to those without the diagnosis. This has been the case since the Vietnam era, and I just feel that since this data has been known since the Vietnam era, there should have been more steps taken to combat PTSD, and especially those veterans who screen positive for PTSD to help them stay out of the suicide statistic, because just in 2014 there were 607 military suicides in 1 year, and if those people screen positively for PTSD, I just feel like there should have been more that the VA should have done. This data has been around a long time, and there should be no reason for the treatment not to be better, the treatment options not to be out there. There should be different things going on there. Moving into just my survey and my survey results, I did have 21 people complete the survey that had been to the VA Medical Center for Mental Health Care. 14 of those people felt that their treatment lacked in some area. They were given options such as it was hard to connect to their provider, or they were bounced around from provider to provider. They were unhappy with the treatment options, things like that. They were offered them choices for. 9 reported having unsatisfactory experience with their provider, but fortunately 5 people stated that they were very happy with their provider, which I was glad to hear. When talking about the alternative therapies that are recommended by the PTSD manual put out by the Department of Defense for the VA Medical Center, we're talking EMDR, cognitive therapy, exposure-based therapy, stress inoculations. These are all treatments recommended by the Department of Defense. Of the people surveyed, 14 people had no idea what these treatments are. They'd never been offered the treatment. They'd never been talked to about the treatment. And I just find that statistic upsetting, because if these are treatments that are recommended in the manual for PTSD treatment, they need to be being offered. They need to be on the table, not just medication. Some of those people surveyed complained about the medication. One person said they were offered over 4 medications, and then they just stopped taking the medication altogether. So I feel like it's sad when you have people who want to not be on medication, who want to live their lives without taking a pill every day, but the option is not given to them, and so they may not know that it doesn't have to be that way. Of those 21 people surveyed, 12 of them have sought mental health treatment outside of the VA Medical Center. I think that's an important thing to know. You have unhappy veterans in their treatment, and they are choosing to go to an outside provider. This is important. Only 2 people of those surveyed are happy with their provider and trust their provider to make the decisions for them. The others of those surveyed said their say in their mental health treatment is important, and they want to say in it, and they want to have options. Those are also important. So in conclusion, I just found that the VA is not following the PTSD guidelines brought down by the DOD. They're not following those guidelines. I don't know if it's a leadership problem. I don't know if it's a followership problem. I don't know, is leadership implementing them and the employees don't feel comfortable enough to follow them? Or is leadership telling them to follow them and they're not giving them the tools necessary, but the staff doesn't feel comfortable to say, hi, I don't have the tools necessary? I don't know. I do think a change in leadership, starting with the Secretary of Veterans Affairs, Robert McDonald, it needs to start with him, and he needs to start evaluating the leadership in the individual VAs. And once that leadership is pinpointed and the correct people are put in the correct positions, they can start looking at the subunits of each VA, the people that are running the day-to-day operations, and see what's going on. What do they need? What do they not have? How do they feel? What's the culture like? And all of that needs to be addressed. It's not going to be an overnight thing, I understand, but it needs to be addressed. Or just privatize the healthcare system for veterans, and so they will be able to speak their mind with where they go. If they're unhappy at the VA Medical Center, they have the option to go somewhere else and receive the free mental health care treatment that they would receive at the VA, and not have to choose between getting free health care or having to pay out of pocket, which they may not be able to afford. Those are things that veterans shouldn't have to worry about, but if you privatize that healthcare system, they're going to have an option on where they go, and they're going to speak with their feet and go where they know they're going to get good treatment, and go where they're happy and they're thriving. That is my thesis assessment on empowering veterans in the mental health care system at the VA. Thank you so much for allowing me to share this information.